Apple a Day Pediatrics, helping grow healthy kids. What is your name?
Dr. Jim Webb. I'm a pediatrician in Oswego, Illinois at a private practice called Apple a Day Pediatrics. And I am on staff at Rush Copley and Edward Hospitals.
Where did you grow up and where did you go to school?
I grew up in the Chicagoland area. My dad was a blue-collar worker. My mom was a homemaker. My brother is the only other physician in the family, so I come from very humble roots. And then I went to school at University of Illinois. I'm an Illini for my undergraduate studies, and then I went to University of Illinois, Chicago for my medical school. And then for residency, I went to Loyola University in Maywood.
What should a new patient look for in a pediatrician?
Well, a new parent looking for a pediatrician should talk to other individuals in their community, whether it be family, friends, neighbors, and find out who they see. Find out who they trust to care for their children. These are oftentimes very reliable sources. Also, you should look for somebody that is board certified. Somebody who has taken continuing medical education, who is up to date on pediatrics. You want to find somebody that meshes well with your personality. Here my brother and myself, we're very approachable, willing to listen. We get to know the parents really well, the kids really well. They feel like they can talk to us. They don't feel like they're talking to sometimes a doctor. They feel like they're talking to just a normal person. And even though we have that skill, that knowledge base to assist them in medical issues, it provides an environment where they can open up more to us, and we can provide more information to them, and it's just an overall win-win situation.
How long have you been practicing?
I've been practicing general pediatrics in private practice for 13 and a half years. I originally was in a private practice in Naperville for 5.5 years, which interestingly enough I enjoyed, and I really modeled this practice after that practice. I add a little humor to it. I think that's very important. My brother would agree on that. I think it's very important for the kids to feel comfortable. Sometimes getting down at their level is a nice way to break the ice.
What are your hobbies?
Drums are my passion. You can ask anybody about that. It's something that I constantly, if I'm not working, if I'm not reading about pediatrics and in literature, keeping up to date with those issues, I'm playing drums.
What is your family like?
I have 4 kids, 2 boys, 2 girls. They are my life. I have a 14-year-old boy, Nikki. I have a 12-and-a-half-year-old boy, Nathan, a 10-year-old girl, Gabriella, and a 7-year-old girl, my baby, Gracie. And that's a lot of things that I can offer parents too, is basically I have 4 kids, 2 boys, 2 girls. I can give you a lot of personal information, experiences that I've had over time.
Is this practice accepting new patients?
Yeah, we're accepting new patients. It's like I said, we're a smaller practice, 2 of us, but we offer a lot more, I think, than the bigger practices do around here. We offer a different product. Again, it's more warm, fuzzy, personable.
Have you been certified by the American Board of Pediatrics?
Yeah, the American Board of Pediatrics, basically, initially you take a series of exams, and of course you must pass them. And then as you come out of residency into a practice, you take your first board exam. And then you're required every year to take continuing medical education. It's a certain number of hours. It happens to be 50. Most of us do much more than that just to stay up to date with pediatrics in the literature.
Do you have any subspecialties?
My main interest is allergies and asthma. It's definitely an important aspect of pediatrics. Other interests, big interest of mine is dermatology. Pediatrics is a big area where you have a lot of different rashes come in.
Do you offer same-day sick appointments?
We certainly do. We at Apple a Day Pediatrics have appointments available for our parents when they call in. We specifically leave slots open to accommodate them. again, Apple Day Pediatrics is very open to accommodating parents. I mean, that's one of our main goals.
Is there a designated waiting area for well children and a separate one for sick children?
Yes, there is. You're going to have times where parents are, their kids are healthy. They don't want to get them sick. There's a lot going around in the community. And they are very appreciative that we have a well waiting room where if you're coming in healthy for a well visit, that we are, we're keeping you a little more isolated from those that are sick. Now, those that are sick, the nice thing about the practice too is we have a large waiting room.
How long should a child see a pediatrician?
Well, I mean, again, we see patients up to 22 years old. The reason why we've chosen that age is because when kids go off to school, they're 18 years old. They may come back into town for holidays, vacations, what have you. Maybe they need a sports physical, maybe they're sick.
What is a prenatal visit?
Prenatal visit basically it could be new parents or parents that already have children that come in to meet the physician to make sure that they mesh well, to ask a variety of questions. So we talk about a variety of things. So it's really open-ended. I mean, the parents come in with whatever questions they have. I have my own little spiel that I give parents to really start that educational process. And I think that creates that initial rapport that helps our relationship develop over time.
How soon after the birth will my pediatrician examine my baby?
We do see them within 24 hours. Again, we're on staff at Edward Hospital and Rush Copley. So if a parent is, their child is born that morning, we see them that same day. Generally, Dr. John and I will split the shifts based on a weekly basis, where he will do rounding one week, I'll do rounding the next week. If you deliver after the office is opened, we see you that next morning. So it's within a 24-hour window.
What happens during a regular visit to the pediatrician?
Well, it depends what kind of visit it is. If we're talking, a well visit, the baby initially will come on the well side, to keep them from contracting anything in the office. But we have a room that's specifically for physicals. So when the kids come for their well checks and are on the well side, they go back to the room, they ask a series of questions, and then it's time for the physician to come in. We come in, and again, we will ask more questions, and we examine the child from head to toe, and we will tell parents, I will tell parents everything that I find on your child, whether it be normal or abnormal. I try to educate you on various things, again, whether it's normal or abnormal.
How have you seen the field change?
I've seen parents, they're a lot more educated nowadays. Now they're able to go to the internet and research a lot of things. So when they come in the office, many a times, they're prepared. They have questions, and you have to be ready for those questions. So, and that's where being up to date in pediatrics and continuing medical education is important.
What do you enjoy most about being a pediatrician?
The kids that come into our office are just, it's special. There are many kids that come in, and you almost wonder whether they want to come in just to have, a social visit, and it's really fun to get down at their level. It's fun to joke around with them, show a little bit of our immature side, if you want to call it that, and play with them to some degree. I mean, we actually, the field of pediatrics is special. I love the parents. We have very good families that come here. We've had relationships that have been long-lasting. I have patients that I've seen for the entire 13 and a half years that I've been doing this, and it's a lot of fun. They can joke around just as much as myself and the kids, and we all develop a level of comfort, a level of rapport, and from their standpoint, a level of trust in our care.
What is unique about Apple A Day Pediatrics?
Basically, we want to, again, be approachable to parents, be willing to listen, to spend ample time with them, to educate, to hopefully have those long-term rewarding relationships. Apple Day also, we have that smaller atmosphere where you have two doctors, twin doctors, which I'm very proud of. He's 4 minutes older than me, and that's fine. I'm the newer, improved version. And it's just nice that we think alike, A lot of times I know what he's thinking and how he's going to approach a patient. Other things, just the staff. We feel like we're a family. We like to feel like our patients are part of our family. This is something that is part of who Apple is. So this Apple Day is very special to me. We feel that we are as good and probably better than any other practice in the community.